Vector-borne diseases are a major threat to health and economies globally. Vectors such as mosquitoes transmit viruses and parasites to humans, which can cause mild to severe disease. The WHO estimates that vector-borne diseases account for approximately 17% of global infectious diseases, with around 700,000 attributable deaths each year.
The Aedes aegypti mosquito spreads several disease-causing viruses, including dengue, chikungunya, and Zika. The Zika virus in particular can have devastating consequences for a newborn. In the Caribbean, mosquito-borne diseases threaten public health, tourism, as well as social and economic development. The economic burden can be severe, ranging not only from a loss of productivity due to illness and death, but loss of revenue. The Zika epidemic of 2016 caused an estimated US $1.8 billion loss to the Caribbean tourism sector.
We in the European Union recognize the strong need to support strategic and focused interventions against mosquito-borne diseases in the Caribbean region. For this reason, the European Union has supported CARPHA since 2016 in its efforts to reduce the spread and impact of mosquito-borne diseases. We are therefore pleased to have renewed our commitment with CARPHA through this €5 million program.
The EU-funded Zika and other mosquito-borne diseases project highlights a strategic, multi-sectoral approach in the fight against vector-borne diseases in the region. The main areas of focus are strengthening disease surveillance, improving vector control operations, broadening community engagement, and investigating new safe methods of mosquito control using a partnership approach. The main objective of this project is the reduction in the morbidity and mortality associated with vector-borne diseases in the region.
We've been the key beneficiary of interventions by the Caribbean Public Health Agency, CARPHA, and many projects that are funded by many donors such as the EU, the European Union. We've benefited from insecticide resistance testing, capacity built in entomological surveillance, field activities, many training interventions as well, and looking at how to build a robust system with regards to integrated vector management.
As we look to the future, we cannot underestimate the continued efforts and resources that are necessary to turn the tide against mosquito-borne diseases. The COVID-19 pandemic of 2020 has left the region's public health systems extremely vulnerable to other public health threats. A collaborative effort is required to reduce the spread of disease. Everyone, the public and private sectors, communities, and individuals must play their role in this call to arms.